will have a couple of debates. We will be hearing from ministers and from experts from across the board on this hugely important topic. However, let me give the floor to open and set the scene and give a welcome and explain why we're here today and why it is so important. The S&D Group Chair from here in the European Parliament, Ms. Iracha Garcia Perez. Thank you very much for joining us. Please give us your thoughts.
Thank you. Y bienvenidos y bienvenidas. Hemos
Welcome
vivido
to all
unos
of
meses
you.
muy complicados
We
con
have
una
lived through
pandemia
some
que nos
very
obliga a
complicated
actuar
months
con
with a
urgencia no
pandemic
solo
that forces us to act urgently, not only to stop the spread of the disease and avoid more deaths, but also to mitigate the socioeconomic effects and to be better prepared towards the future. This afternoon, we have had a special panel that will look at what the European Union can do to ensure that all citizens have equal access to quality healthcare, affordable treatments, as well as medicines. Representatives of the 3 EU institutions, Commission, Council, and Parliament, and experts in the field are taking part in the event. Thank you all for joining us. I would like to thank the health ministers of Spain, Salvador Illa, Italy, Roberto Speranza, and Sweden, Helena Hallengren, for their presence. I also thank the President of the European Commission, Ursula von der Leyen, whom I would like to congratulate on her first year of work as the head of the European Commission, as well as her entire team for providing a rapid response to the demands of citizens and also of this Parliament. At the beginning of the crisis, we saw how the Union did not have the mechanisms to respond to the health emergency, and a race broke out between countries to buy masks, protective equipment, respirators, and medicines. The same thing happens with border closures, but critical voices were soon raised. The disappointment shown by citizens is a sign of their Europeanism, of the fact that by competing, we all lose, and by working together, we can move forward. That is why now, once the initial reaction has passed, we simply cannot let them down. In these months, we have already witnessed a big change, with more collaboration amongst member states and the European Union taking the initiative for the procurement and distribution of vaccines. This is very good news, which presents us with a more hopeful horizon in the coming months. However, this is not enough, and there are still several structural shortcomings that we need to address. Whilst it's true that health is a national competence, it is something that we will have to reflect upon at the Conference of the Future of Europe, which I hope will start very soon at the beginning of 2021. However, we can already go a long way with the current powers that we have. It is fundamental to ensure that all citizens in the Union have the same rights to high quality healthcare and at an affordable price. We have seen that this is not always the case, and often the most vulnerable have more problems accessing medicines or certain treatments. We have those with the least economic resources on the one hand, and the elderly on the other, which are the two groups that have suffered the most from the effects of the pandemic. Furthermore, we must also mention healthcare professionals who have had to work in extremely difficult circumstances, sometimes without enough material or having to double their shifts. It is true that nobody expected a crisis of such a magnitude to take place throughout the world, which puts a great deal of pressure on all systems at the same time. And that is why already in May, our group, Socialists and Democrats, have called for a plan to build a European health union. The European Commission was quick to react, and this plan is now on the table. We will then have to develop it with more concrete legislation. And here, the Socialists and Democrats are working to contribute with initiatives and proposals. The EU must play a greater role in the joint purchase of supplies and create stocks that can be distributed when necessary. This applies to both equipment and medicines. There are some novel treatments for other diseases, and everyone in Europe should have access to them. Right now, the EU depends on imports, and sometimes this supply chain has problems. There are disruptions, and that's why, in addition to actions to prevent shortages of certain products, we also want to address the supply chain, how prices are set and reimbursed. Apart from the communication for a European Health Union and the pharmaceutical strategy, the budgetary agreement we have reached will be key. It increases funding for the EU for Health program, and we would have liked to have even more funds because they are what we need beyond this crisis for other diseases such as cancer or some rare diseases. But now the most important task is to get the budget out as soon as possible. Furthermore, COVID has demonstrated the interdependence between human health and the health of the planet. Health risks increase as we allow the degradation of the environment and the destruction of biodiversity. We need more research, and this is also provided for in the next multi-annual financial framework. On our behalf, I can say that we will continue to insist for it to be adopted as soon as possible, and while we continue to work on improving our European project. Crises have always allowed for Europe to grow, as long as Europe was able to respond in a united way for the concerns of citizens. Let us share this vision. Thank you.
I think we are now going to hear, as you've mentioned, from our European Commission President, Ms. Ursula von der Leyen, to outline her plans. Okay. Unfortunately, we have a small technical hitch in getting to hear from the President. So I'm going to take this opportunity. Thank you very much, Italia. Let me ask you, I mean, we heard there your opening thoughts. I mean, why do you think the President is joining us today? Is this because of the COVID crisis, or is this something you think is strongly on the agenda?
Yo creo que en estos momentos la ciudadanía.
Well, I think that citizens currently expect a joint response, a stronger response on behalf of the Commission. And unfortunately, as I very well pointed out at the beginning, due to the pandemic, citizens felt that Europe was not strong enough in responding to their problems. And that's why we deemed it appropriate to open the debate and to invite the President and to speak about an inclusive health union. It's true that many competences lie in the hands of member states, but it's important to increase the coordination.
Hearing now that we do finally, thank you very much, have our European Commission President, Ms. Ursula von der Leyen. Thank you very much for joining us. The floor is yours.
Thank you very much. And thank you, dear Irache ministers, honorable members and representatives of the health sector. So good afternoon to all of you. We all know that in tough times like these, we're all in crisis management mode. But the greatest mistake we could make is to only focus on today's difficulties. They are important, but then to lose sight of the future. So thank you very much for today's event. This is, as you said, Irache, not just about solutions to the current crisis, but it is about a vision for Europe. So let me begin with the words of a father of European integration, Jacques Delors. When Delors took office, Europe was in the middle of a crisis, although of very different nature. They called it Euro stagnation. So Europe's incapacity to move forward. But something was changing. And there was new energy in the European institutions, and Delors knew it. And in his first speech to the European Parliament as President of the European Commission, that's how he described his own task. He said, "We are in a situation where the community can seize the favorable winds or else once again miss its chance," end of quote. So today the winds are stormy, but just like then, there is a chance that Europe cannot miss, a demand for European action from the European people. 2 out of 3 Europeans tell us that from their point of view, the European Union should have the ability to deal with a health emergency. And this is also what I believe. The European Health Union is the next step on the path towards a better union. I see at least 2 reasons for this. One is to improve how we prepare and respond to crises. This is the first pandemic that we experience in Europe. It takes such a heavy toll on us. And we might face similar outbreaks in the future because of the loss of biodiversity. Other zoonotic diseases might hit us. The health of our planet and the health of human beings are linked. We know it by now. So we call it a One Health approach. And in the event of another pandemic like this, we must be sure that all European countries are equally prepared and responsive. This is the most immediate reason for advancing towards a health union. Health is a national competence with national and regional authorities in the lead. But there's a lot more we can do at EU level by using the full potential of our treaties. So greater cooperation is already possible, and it can save countless lives. And this is the logic behind the Health Union package that we presented in November. There are 3 sets of initiatives in the package that I would like to mention today. First, to be better prepared and responsive. Second, on the role of European agency. And third, setting up a real European health union beyond emergencies. So first on cooperation. At the beginning of the pandemic, we saw that lack of coordination brings a high cost for member states and for citizens. But after the initial shock, European coordination kicked in. We have, for example, established the green lanes to ensure the seamless flow of goods in the single market. We have saved money through the joint procurement of medical equipment and used our market force. We have addressed the shortages of ventilators and protective masks. And we have given clear guidelines to people traveling across national borders. We are now turning the ad hoc solutions into structural measures. So we propose to transform the decision on cross-border health threats into a regulation. And this will make cooperation on health emergency a legal obligation, not just a makeshift measure. We want to have an EU-wide preparedness and response plan. This European plan will rely on coordinated national preparedness plans, which will be audited. They will be stress tested with the support by the European Commission. And the regulation will also enable the Commission to declare a state of EU health emergency. This would, of course, be based on the advice of an independent advisory committee and always be in coordination with the World Health Organization. Declaring a EU health emergency would trigger greater coordination among member states, so joint procurement of medical equipment, and it would trigger the deployment of EU outbreak assistance teams. In other words, next time, Europe should be ready and fully equipped right from the start. Our second set of proposals concerns European agencies. The ECDC and the EMA, European Medicines Agency, they have been doing an extraordinary good and essential job since the beginning of the pandemic. But we must all say their current setting has serious limitations. So we propose to give them more responsibilities, more powers, and more resources so that they can better support the member states. We want to strengthen the ECDC with greater capacity to analyze big data and to use artificial intelligence. This is of utmost importance. So the ECDC can become our kind of state-of-the-art public health surveillance system. And based on this, the ECDC should provide very practical recommendations to member states. And in an event of an outbreak, it should dispatch a health task force to member states in need. As for the European Medicines Agency, we wanted to monitor and to address the shortages of medicines and medical devices. We've seen in the crisis that this can happen. And on top of this, we also want to create a new European Health Emergency Preparedness and Response Authority, long name, so HERA for short. HERA, just like the queen of Greek gods. HERA will focus on foreseeing the next crisis and, if possible, averting them. So HERA should be able to tell us this is the next threat that we might face in a number of months or a number of years. And we want to be one step ahead of the curve. HERA will be our main tool of foresight and for planning. And HERA will then follow the whole process, leading from conception to deployment of the new therapies, vaccines, or technologies that are being needed. And on top, HERA will work with all relevant players. So we're talking from innovative startups to, for example, civil societies and NGOs, but also various organizations or the big multinationals. This time we want to make sure that Europe can quickly develop and deploy the solutions to the next health crisis. Now, when I'm explaining this, think about the work we are doing to secure doses of a future vaccine for Europeans. This is a blueprint. What have we done? We have negotiated and concluded 6 contracts with pharmaceutical companies so far. We have learned that we are much more effective when we go to the markets to negotiate together. We have market power and the leverage of 450 million Europeans. So in a result, today, the European Union has one of the most comprehensive vaccine portfolios in the world. And this is something we should keep in mind, even beyond these times of crisis. So in sum, these 3 agencies will provide member states with all the guidance, the expertise, and the solutions they need in an emergency. Our third and final set of initiatives looks beyond crisis management. So the European Health Union shouldn't just be about emergency. There is a clear European added value in cooperation on health issues, economies of scale, or common standards, or even greater equality across our continent. So the European Health Union can contribute enormously to improving national health policies. Together, for example, we have the strength to support the development of groundbreaking medicines that are as well as affordable, as widely available. Both factors are important. And this is the core of our pharma strategy, for example. New medicines and new therapies should be available to all Europeans in all European countries quickly. Of course, only when they have proved to be safe and effective, but then everybody should have access. And we are putting our union's critical mass, in this case, to the service of patients and member states. Many of our public health issues, we know it by now, need to be tackled on a continental scale. So take, for instance, the sharing of data among researchers. If you talk about access to high quality and standardized data coming from all corners of our continent, that can be an incredible asset in the hands of European researchers. This is one reason why we're creating a European health data space. When talking about data sets, we all know size does matter. So access to big data will also be a pillar of Europe's Beating Cancer Plan for better prevention, for better diagnosis, and of course, for more equality across our union. All of these initiatives will shape the European Health Union. And it is now up to us, Commission, Parliament, and national governments, if I may take the words of the law, to seize the wins and take another step towards a better European health union. Thank you very much for sharing this time with me, and I wish you a very good webinar. Thanks a lot.
For your time today. Obviously, this is a huge the health crisis. Now, I'm wondering, can you hear me? Is everything going well? Let me just double check that we've got that. We have indeed. So now our next panel, as I say, we're hearing from the health ministers. But before that, in order to open up this discussion, we have here joining us from the European Parliament, the S&D Group Vice President, we have Helene Fritzon. The floor is yours.
Thank you very much, and good afternoon, everyone, and dear presidents and dear ministers and dear participants. It's a great pleasure for me to welcome you for the first panel this afternoon, where we will address the issue on how to improve European coordination and response to the health crisis. Looking at lessons so far from the COVID-19 crisis from an European Union perspective, it is clear that initial responses in the COVID-19 outbreak in Europe were rather individual and selfish from some member states. In addition, member states took different approaches and different strategies without much coordination. Eventually, a common European response did come, and many of those individual and selfish reflexes were reversed. But it was delayed. The European Centre for Disease Prevention and Control played a fundamental role in providing advice and data. But data from member states often is not standardized or comparable, and guidance from ECDC can be ignored. The European Union did have tools already in place to deal with health emergencies, but we have never faced a challenge like this before. The joint procurement mechanism has been used, but it was quite slow in responding. So stockpiles were activated and deployed to areas most in need, but they were rather modest in size and again, quite slow to respond. So I think it is safe to say that the virus has highlighted that the European Union does not have strong enough tools to deal with an emergency such as the spread of COVID-19, which by its nature knows no borders. While the European Union has significant competence in public health, it is important to underline that healthcare systems are the competence of member states, and this should not change, of course, but however, clearly, this crisis has shown us the need to increase cooperation and the need to increase the European Union's work in health, which is why we in our S&D group also adopted a position paper in this issue. Our proposals for a health union include, amongst other things, stress tests and a strengthened joint procurement mechanism and a strengthened European health agencies. And moreover, a few months ago, I had the great pleasure to have a video meeting with the director of the ECDC. The meeting was very interesting, providing me with an overview and presentation of the mission of the agency. In particular, linked, of course, to the ongoing COVID-19 crisis. I think that the Commission's different proposals and measures for our Europe is a step forward. So in this context, I very much look forward to the input from our ministers today in this panel on how we can continue this important work and how we can improve European coordination. So finally, it is important to highlight that although we have seen many tragedies and challenges in the ongoing crisis, we have also seen many examples of solidarity, such as member states assisting each other with cross-border healthcare. These lessons will be very important for the future, and I look forward to listening to how we can build on these important experiences so that we are better prepared for the future. So thank you for your attention today. And now I'm happy to pass the floor over to you, Jennifer. Thank you very much.
Thank you very much, Helen. Now, this panel, as you say, is hugely important that we learn from what's happened during this crisis. But the main thing that we're talking about is a strong and inclusive health union. So we are pleased to welcome from Sweden and from Spain the ministers responsible for health. From Spain, we have Mr. Salvador Illa, and from Sweden, Lena Hallengren. Thank you very much for joining me. We've heard from our MEPs here in the Parliament. We've heard from the European Commission President. So, Ministers, I'm looking forward to hearing from you. And let me give you a sort of general opening question to ask, what are the most important areas for immediate action towards a European health union? Your broad thoughts. Perhaps, Mr. Illa, I could go to you first. Okay, come back to me.
Overall, the European Union has, and so I think this particular issue on vaccination shows the way. Maybe I would highlight that strengthening ECDC and European Medical Agency, also the Health Security Committee could be the next step to strengthening European health policy, a common European health policy.
Thank you. Thank you for your opening thoughts. Let me turn now to Ms. Lena Hallengren from Sweden. You're at the opposite end of the continent, but I'm sure you share the desire for some sort of common health view. So let me give the floor to you and give me your opening thoughts on what could make a stronger and more inclusive health union.
stata soltanto una questione di sistema sanitario.
Thank you. I'm sure we all agree there. Let me turn, Mr. Iria, to you again. In Spain and across member states, there has been a substantial pressure on intensive care units. So that goes absolutely without saying. We've seen that from the length and breadth of the continent, as well as a need to increase capacity. So considering your experiences, how can we improve the resilience of health systems? This resilience is very much the key word. And in light of particular pressures on intensive care capacity, what could be done at an EU level?
Well, first of all, the Spanish national health system has resisted taking into consideration the surprising way in this in what this pandemic affected us, has responded in a quite appropriate way to the needs of the population. So we had a stress on ICUs, also in hospitals, but during the first wave, we were able to assist every Spanish citizen that was that needed hospitalization or care in ICUs, and also in this second wave. Nevertheless, I think it would be very helpful if we set up European standards, taking into account the differences between countries, but setting up European standards, I think it would be extremely helpful in order that each country can better prepare for the next pandemics we're gonna confront. Also, for sure, we should improve and invest more in the health system.
Dovremmo anche investire di più nel sistema sanitario.
Countries are trying to make our best to increase the resources devoted to the health systems. This should be made in a gradual way, not just next year, but coming 5 to 10 years, in order to improve our capabilities and our capacities. And also, I would like that European budget increases the resources devoted to the health systems.
Or ICU units. Let us talk a little bit about the other form of resilience, which I know is very important, is about mental health resilience in the healthcare system as a whole. Perhaps you could reflect on sort of both of those areas of resilience.
Riflettere su alcune aree.
Yes, I know there's a little bit of problem with the delay with the interpretation, but yes, to you, the question is just to reflect generally on resilience, both mental health, both the health of patients, and of course, the resilience of the healthcare system as a whole.
È importante
Thank you. Now, let me remind my speakers, we have discovered our source of gremlins with the translation. If I could remind all speakers, and for the next panel as well, that you press the button at the bottom of your screen for the language you choose to speak in. That will solve, I hope, many of the issues we're having with translation today. But of course, thank you to the translators who are doing a fantastic job in widening this debate to more than just the English-speaking listeners. So thank you for that. Let me come back now to Mr. Iya, to you. So the S&D Group is calling for strengthened information and data sharing and calls for this European health data space. So Spain is part of the Valletta Declaration Group, which aims, among other things, to share this data and information, which is so valuable, particularly for health technologies. So from your perspective, could a European health union help to facilitate this? And also, how might that have mitigated problems we've seen during this current crisis? Tell us a bit more about this whole data sharing space and what you would like to see from it, please.
Thank you very much for the question. And in fact, I see that one of the lessons of this COVID-19 pandemic is the need to strengthen the information systems. We have learned that our information systems were not prepared or dimensioned for such a huge pandemic. So we should strengthen not only the data sharing mechanisms, but also the standards on which data are collected in order to assure that the information is comparable between member states and is the basis of a good decision process, a decision-making process. Besides on this, it's important to have also an European level data system in order to help investigation at a European level. Maybe this is one of the strongest points of a future European health system, to have a unified data system in order to help future investigations, future analysis, and also to take advantage of this in front of the pharmaceutical companies that want to develop new medicines. So for sure, we should focus on these issues, which, from my point of view, is on the most important, of the highest importance.
Thank you. Ms. Hallengren, you've heard there about the importance of data sharing and how that maybe we have learned lessons from this crisis. Do you think, Ms. Hallengren, that in a sense that sometimes we say that a crisis or a disaster can be the mother of invention, do you think there are lessons to be learned from this crisis that will help in the future, because we have long-term problems in Europe with regard to, for example, an aging population or other issues like that, resistance to antibiotics, these other issues that we may see coming along a bit more slowly than the current pandemic?
Yes, you almost gave the answer in your question, because of course we have a lot to learn, and we have things to learn during this pandemic to make sure that we all the time we can improve the healthcare, the cooperation, I mean the internal market, for example. We have learned the way we're working with a common vaccine, that has been really successful, and as been said before, some kind of a blueprint on how the European Union, the added value that when we're cooperating in the European Union, I think that is such a good example of that. But as you said, Jennifer, I might be quite concerned about thinking of all the health threats we are facing, but not in that very direct or, how should I say, I mean, it's more of a slow change. And we know that when we get to some kind of a tipping point, that will be very dramatically. And the AMR, antimicrobial resistance, that is what I'm considering and what I'm very concerned about, because we know that the consequences will be severe for the healthcare. That will not be an issue about cooperating among PPE or opening the borders or whatever, collecting some kind of fund sharing or whatever, because if we don't deal with the AMR issues now, we will have severe problems in the healthcare sector. And I think that we just have to realize that. And I don't know if the pandemic is teaching us that, because I feel that the pandemic is showing that we have the possibility to unite when we decide, but we need to do it even when it's not in that way acute. When it's not the same, you know, it's. Everyone can feel that this pandemic is for real, but the AMR changes is more in a slow way. You know what I mean. I think that is a problem, because we need to unite among also the issues not in that way acute.
I think you're right there in talking about AMR, antimicrobial resistance, certainly doesn't recognize any borders in the same way the vaccine doesn't, or the pandemic doesn't recognize any borders. So to Mr. Ilya, how important is it that for these other issues that we've just been speaking about, referring to other diseases, other resistances, that Europe works together in light of the pandemic? Because, as I say, borders don't matter to diseases or to illnesses.
Well, health is probably at the core of the welfare state, and Europe is well known for its welfare state that for sure we want to preserve, and it's one of the identification, one of the most important things that Europe can show around the world, the welfare state. So for sure we should devote political resources, economic resources to building a European health system. I think European citizens would not understand that during the next pandemic, our union is not prepared to have a quick, strong, and coordinated answer. And also, they would not understand if we do not share our management abilities and our knowledge in order to deal with other health problems. Our market power is so important and so big that we should use it in order, for example, to set up and develop our pharmaceutical strategy, in order to set up investigation resources coordinated at European level. So for me, it's one of the issues, a European health policy that strengthen the most our European Union in the front of our citizens. And I think we are not on the way to, in the words of our Commissar von der Leyen, lose the wins, these strong wins, to take the chance to strengthen our union in the coming months and years.
Well, staying with you, let me ask you a follow-up question there, because it does require investment into healthcare. As we've said, it's part of social care, it's part of that social pillar. But yet some countries are still talking about austerity. So how do we find a balance between needing to invest in healthcare and financing it on the other side?
Well, one of the biggest differences between these crises started by the Covid-19 pandemic, but also the economic crisis we are going through, and the 2008 Great Depression, is the way Europe has responded to it. In the first crisis, in the 2008 crisis, it was through austerity, with austerity policies, which has proven not efficient. Now we've changed, and we are responding to this crisis with the strongest European response at a health level, but also at economic level, with European packages of investment, with European coordination among countries. So this is one of the huge differences, which I'm proud of it. I mean, I'm proud because we have learned of the lessons of 2008 Great Depression. And I think nobody discusses today that austerity damaged our health systems, in the sense that they were not taken care during 10 years, and their financing was not improved during 10 years. So we need to recover these years of austerity, but not only with one or two budgets. It needs to be done in a gradual and progressive way. in my opinion. During the next 10 years, we should improve year by year the financing of our health systems in order to accommodate them to the level we need in order to provide a universal health system in Europe. This is one of the best ways to assure equitable the equity among European citizens, which is one of the goals of our European Union.
Thank you. Ms. Hellengrad, let me turn to you. I mean, I mentioned vaccines there when we were discussing, and I think we probably need to ask you just to press English on your laptop. That would be great. So we discussed vaccines there and the funding of them and so on. But how important is it that we get vaccines to the most vulnerable people and then to everybody in a fair and equitable way? So I guess access is the main question there, to vaccines in particular, given the current pandemic, but to healthcare in general. Could you reflect on that and give me your thoughts, please?
I'm sorry, I had the interpreter at the same time, so you have to repeat the question.
Sorry, once again, I'm asking how can we ensure that members of the population, vulnerable members, but everyone else in the population gets fair and equitable access to a vaccine and to healthcare in general?
Well, when it gets to the question or the issue of vaccine, I think the way we're working now within this negotiating group where all the member states are represented, where we get our share related to the population. And then, of course, it's important that in each country you have a distribution of the vaccine to all the citizens. I think just to make sure that everyone is getting the vaccine to their countries, I think that is something which is really good. And without this not just cooperation, but without the union and without this kind of negotiation, we will never have this kind of, I would say right now, positive situation when it's as we are having. Then, of course, I mean, talk about healthcare is quite complex in Sweden. It's not just an issue of how do you do it in Sweden, but we have 21 regions and we have lots of municipalities. Everyone is dealing in different ways and in different. They have a responsibility for the healthcare for different part of the welfare for the healthcare. Oh. So I mean, it's important that that you have the possibility when it comes to the vaccine. It's important, of course, that we have this kind of cooperation, but I think it's also difficult because the healthcare, as I started by saying, it's so fundamental for the welfare state, for how we are working to make sure that we have equal access within our country. And I think it's quite a long way to, we need to have a lot of discussion about how to cooperate because it is a natural competence. And I don't like to start by saying that, but I think it's important to remember that and try to find what is the added value with the cooperation on the healthcare, because I can see it in many areas, but I think it will take a lot of time. We have to give it that time to make sure that we're united in the progress on the healthcare.
And staying with you, I want to ask a follow-up question, which is simply, what has been your experience during the current pandemic of cross-border cooperation? Could it have been better? Could it have been worse?
Well, I think to start with the positive, it is the question of the vaccine. We have learned that we need to cooperate to make sure that we get what we need. And I would say that the common approach that we're having as a union has given not just the European Union, but probably globally, a faster access to different vaccines. As I started from the beginning, it was a problem when we had closed borders, because that a consequence of that was that PPE and medical devices and so on didn't reach all the countries ordered. And I'm sure we can do a lot of things different, but it has been a crisis, the biggest and the most the biggest crisis in a modern time. So of course we need to evaluate and try to learn from it, but at the same time we're still in the middle. So just the fact that we could gather among the vaccine issues and with such a successful approach, I would say that we have learned that we need to cooperate, and we can show to ourselves, to our countries, to our governments that cooperation is very successful. So let us continue with that on all the areas where we can find this added value, also on the health area.
Mr. Iya, from your perspective and from your experience over the last few months, has there been enough cross-border support? What would you like to have seen done differently, or what would you like to see done better in the future? Just your experience, really, in the case of the face of the pandemic.
Well, from the very beginning of the pandemic, there was not enough cross-border support. I think we were, all of us, we were surprised by the huge magnitude of this pandemic, and we didn't set up a cross-border cooperation properly. But it took some months to set up a properly cross-border cooperation, and I'm very proud, and I want to congratulate the European responsibles for this, for the response regarding the vaccination process. I think this is a very, very, very important step forward, that Europe has been able to have a common European strategy on vaccination, that we, all the member states, have been able to get a very good portfolio of vaccines, and that we have shared up the same strategy, and that we are able to get the vaccine at the same time all the citizens of Europe. This is a huge step forward. I can imagine how at a state level would have been the reaction regarding a vaccine, and it has been on the benefit of all the European citizens, in the sense that we have used the market power of Europe for 150 million citizens. So I think this has shown the potential of this cross-border cooperation. I'm very happy to hear that this initiative of a European health policy is being discussed, and it's gonna be implemented hopefully during the next months and years. I think it's a step forward, a very important step forward.
Final question to you for both. I mean, we have seen from here in the Parliament today's host the S&D position paper on what they believe needs to be done next in order to guarantee a strong and inclusive health union. So let me ask you what you think, to both of our minister speakers today, what you think should be the next steps towards a European health union in the shorter term, so in the coming months and up towards the end of next year, rather than thinking further afield, which we know we must do to plan for the next crisis or the next pandemic or whatever comes afterwards. But immediately, in the short term, what do you think could be done? Ms. Hallengren, let me come to you first for your final thoughts on that.
Well, I think it's such a good arena for us to have this kind of webinar. I think we need lots of talking, lots of trying to understand the different perspectives when it comes to the issues of health union. I think it's safe to say that we're already moving at a fast pace, and since the mid-November, the Commission is presenting a new pharmaceutical strategy. I think that is very both ambitious, but also very important way for us to make sure that we are better prepared in the area of health. And also, of course, maybe make sure that we have more of these arenas, because I think we have to find the right focus, ask ourselves what issues and challenges we should prioritize given the current situation, because talking health union is very wide. It's a large arena. And I think, as I've said sometimes now during this time, that it is so important. It's a natural competence, and it's such an important part of our welfare systems. So we have to be very careful and very respectful to each other when we are discussing how to, of course, cooperate, try to find the common values, but at the same time respect and make sure that each and every one of us is taking the responsibility we have at the member state level.
Thank you very much for your thoughts on that and for your comments during today's discussion. It's much appreciated. We know how busy you are at this current time, obviously. So thank you for joining us. So Mr. Salvador Illa from Spain, your final thoughts on this question. What are the steps that must be taken in the short term?
Well, I would start by strengthening the ECDC and European Medical Agency, and also the Health Security Committee. I think this is something that is obvious after this pandemic, that we should strengthen with more resources and more responsibilities these two agencies and this committee. And from my point of view, this would be the next step forward.
Thank you very much once again to both our ministers responsible for health there from Spain and from Sweden, giving us their perspective on what is required for a strong and inclusive EU health union, the subject of today's webinar. So, of course, to those of us following along online through the web pages and indeed through Facebook, we encourage you to keep in touch. Use the hashtag EU Health Union, and you can send in your questions for our next panelists. Now, our second panel today is on what we want from a health union. We're going to discuss this. We're going to use the basis of the S&D position paper to draw out some of the different elements that are needed, because it is a multifaceted subject. And so we have representatives from various different, from doctors, from MEPs, from the Patients Forum. So we will get their thoughts across this whole issue. To open up this second panel for us on what we want from an EU health union, we will have thoughts from the S&D Envy coordinator here in the European Parliament. That's Jutta Gutteland. Jutta, can you hear us?
Yes, and thank you, Jennifer, for an excellent moderation. And I'm very privileged to having the introduction to the next seminar. And I would also like to mention that it was very interesting to listen to the health ministers and also to the President Ursula von der Leyen this afternoon. And thank you for all the thoughts from this panel. Good afternoon, everyone. As mentioned, my name is Jutta Gutteland, and I'm the coordinator for S&D in the Envy committee, who is also responsible for the public health. It is a privilege for me, as I mentioned, to introduce the second panel. And here we will listen to experience from people who have experienced COVID-19 in firsthand, representing the patients themselves, as well as many men and women working in the health sector and the healthcare systems across Europe, as well as taking part of knowledge from experts in EU public health policy. And I think we all agree that it is time for Europe to take action. We need to remedy the shortcomings that have become amply clear during this pandemic. And I believe what President von der Leyen was mentioning, that Europe has responded, and we have done many things to overcome shortcomings during this time, but it has also been very clear that people have suffered from limited cooperation between the member states. And it is beyond doubt that our common structures have not been strong enough to overcome the structural problem, and we have seen citizens suffering from that. Our society has been vulnerable and exposed, and it has both, of course, been the situation that people have died and people have lost loved ones in the pandemic. But we also seen that things that we could have done together to limit the problems and to help each other have not worked well. We have had a nationalistic situation sometimes during this pandemic and not helped each other. For example, with imported medicines to be transported between the member states. We all know these shortcomings. And we have all been marked by this pandemic. Patients have experienced substantial risk and suffering, and many have had their essential health care postponed. And the health workforce who courageously fight the pandemic in the front line has experienced high risk and unsustainable working condition. This is also beyond doubt that this is the case. The question is now how to best move forward. How can Europe overcome this type of threat that this pandemic showed Europe and the risk of meeting other threats in the future? And I think that Lena Hallengren from Sweden, who mentioned the AMR, really has a big point in that. That is something that is a big health threat for the world and for Europe. How can we build our society strong enough to meet this and make sure that we protect health and our citizens and create a healthier union for all citizens? The S&D group has vocally calling for the creation of a European health union. And now we succeeded in making the Commission launch it. And currently, the EU regulates many important products and also products who are actually I would say, having the leading role in a health crisis, like pharmaceuticals, medical devices, tobacco, alcohol, food, chemicals, to mention a few of them. And all these products have direct impact on health for our citizens. We also have rules on clinical trials, on health research is financed through EU funds and programs. And furthermore, there already exist a number of executive EU agencies with important public health functions. Many have been mentioned during the first seminar. And finally, we are already today having the Crossborder Healthcare Directive, as well as a limited voluntary coordination between member states. So there is definitely a lot to build upon, and EU action is in this field. But our recent experience have shown that it's not solid enough, and we need to cooperate stronger, and we need to do it better. And therefore, as mentioned, we are very happy that the Commission now has listened to our demand and on the 11th of November proposed means to significantly strengthen Europe's cooperation on health. And the Health Union is the natural continuation of current pathwork of EU rules in the health field. We are talking real solutions here. The Health Union has the potential of being an important complement and support to member states and a fundament to ensure strong enough European cooperation that guarantees that all citizens have equal access to high quality, safe and affordable health care. Ultimately, this is about finding solution that brings the most value into the society and the most value into the lives of our citizens. And we are taking an important step on the way to better health for all Europeans by creating a health union. But it's now important that we find the best possible ways forward on how the health union can develop to deliver more and better health for all, and how we also understand the differences in the member state and their competence in this field. The S&D group has proposed a range of possible solutions here, such as, for instance, the introduction of national stress tests and the setup of minimum standards for the quality of healthcare, new legislation on health and safety also in the workplace, and revision of the Transparency Directive for pricing and reimbursement of medicine. This is to mention a few of these concrete actions we would like to take place. There is still lots of work to be done, and I look forward to hear the input from our panelists here this afternoon about how they think the European Union should develop and how we together can create the best possible health union for all the citizens. Thank you.
Thank you very much for your opening comments. And of course, to our viewers, you can find that position paper, A European Health Union, Increasing EU Competence in Health, Coping with COVID-19 and Looking to the Future. You can find that online if you want to read in more detail at socialistsanddemocrats.eu. So please do check that out, especially if you're going to send questions to our next panelists. So it is my pleasure to introduce from the European Patients Forum, the Director of Policy, Kajsa Immonen. We also have Jan Willem Gudran, the General Secretary of the European Federation of Public Service Unions. Marta Branca is the Vice Secretary General of the European Hospital and Healthcare Employers Association. Professor Dr. Frank Ulrich Montgomery, President of the Standing Committee of European Doctors, also joins us. And last but not least, John F. Bryan, Director of Public Health from the European Commission. Ladies and gentlemen, you are very, very welcome. We are delighted that you've joined us here today to give us each of your unique perspectives. We know that you come from all different backgrounds, and so you will hopefully be able to put together this big jigsaw of what we need to do for a strong health union. So with that, let me ask the opening question to all of you, which is, what do you want from a European EU health union? That's the title of this panel debate. So Kajsa, let me start with you. Give me your response to that overarching theme to begin.
Thank you, and thank you so much for the invitation. It's lovely to be here on behalf of the European Patients Forum. I hope you can hear me well. Yes, we as a cross-disease umbrella patient organization active at European level absolutely welcome the concept of a health union, which is actually what patients and perhaps citizens more widely have been calling for years, essentially, voicing their expectations for the EU to do more on health. In our view, that vision absolutely needs to go beyond pandemic preparedness, important as it is, and really to address the structural and systemic issues that are currently in the way of equitable, high quality, affordable, and people and person-centered healthcare for all. In many cases, the EU can already do more, and it does need a united political will and the necessary resources. So now we have a great deal more in terms of resources in the new EU budget, which is great. And it's now up to all actors to show the necessary political will. And for sure, our systems weren't perfect before. And certainly our patient organizations have been drawing attention for years to issues such as inequalities in access to basic healthcare, access to medicines, but also the different levels of quality and safety and different degrees of person-centered care and patient empowerment, depending on where people happen to live. So the pandemic has been a wake-up call, really, and has managed to put these issues on the high-level policy agenda. I think Europe can do better, and the health union should support a more fundamental approach to build it back better, in fact. One of the things I want to stress already here is that an important thing about being people-centered is that co-production needs to be a part of how the new EU works. Co-production with civil society and patient groups and the communities, from redesigning care practices at the grassroots level to civil society organizations' involvement as partners, both in the governance and the delivery of the new health program. We have a lot of expertise. We have our eyes and ears on the ground, and I believe we are invaluable partners to policymakers. So I'd like to put that up front and center when we talk about people-centered health systems. The people and our civil society needs to be part of it. Thank you.
Thank you. Jan Willem, your thoughts on this and about also the right to care and how that should be at the centre of an EU health union.
Thank you very much for the invitation and for organizing this webinar and to bring together unions, employers and other stakeholders to discuss with you the EU Health Union. Briefly on EPSU, that's the European Federation of Public Service Unions, and we represent the public service workers on the front line of this pandemic. And this includes the millions of workers in health and care across the EU who want to deliver quality care for all doctors, nurses, cleaners, chefs, and so many health professionals. As we all know, they are in the middle of the pandemic under severe strain. They run the risk for their health, and they are put in situations they have to choose who to treat or not. And that should not happen. And the EU level proposal should insist in preventing this from happening in the future. We welcome the proposals of the S&D for the EU Health Union. They trigger an important debate of how we can do better in facing pandemics in general and improve our health systems. In terms of your question, Jennifer, 4 short points. And the first actually goes together with what the previous speaker has said. We think the guiding principle in this discussion should be that the EU level proposals contribute to ensuring that all in the EU can enjoy the universal right to care and have equal access to affordable quality care services and delivered by robust public health systems with universal coverage and including during pandemics. That means for EPSU, my second point, we need to prioritize public funding for health and care, and this after years of coordinated austerity. In the immediate, the Recovery Fund can play a role by assisting countries whose systems have suffered quite heavily during the pandemic. But in the long run, we need not only to address the results of austerity, but have economic policies that make clear what is important and to invest in care and including in staff. This is important. There's a lack of about 2 million health workers in the EU, and this results in high levels of work-related stress and burnouts that impacts on our possibility to deliver quality care and to guarantee the human right to care. That means also prioritizing. Prioritizing also means about being clear what it is that we do not want. And for us, that is the commercialization of our health services and building the EU Health Union on the single market logic. We think this does not deliver the strong and coordinated public healthcare systems we need and not an answer to the challenge before us. The third point is we agree with the idea of the preparedness and stress test as a way forward. Workers demand safety at work with sufficient personal protective equipment, for example. And in this regard, we support also the S&D point in your paper on health and safety. We seek safe staffing levels and the recognition of our work. The results of these tests, the stress tests, should help in funding to make this also happen. In this regard, we're very worried about the recent comments of the European Commission regarding the budgets of a number of member states. The Commission basically is announcing a return to austerity. And concretely, to give you an example, in the draft budgets for France and Belgium, the Commission has criticized the recent pay increase for health workers, and those increases came after years of struggle. And honestly, we cannot deliver an EU health union at the expense of health workers. And my last point, Jennifer, is about governance. And I think the previous speaker also stressed that you cannot have more competences if the legitimacy and participation are not strengthened in the EU Health Union. The EU Commission proposals currently lack a strong role for the trade unions and for the employers. All plans will have to find their way to the workplace, to hospitals, where health professionals and employers need to implement and execute them to deliver care. So the voice of social partners is therefore crucial when discussing preparedness and the resilience of our public health system. So we look forward to continue this work with the S&D, other members of Parliament, and to strengthen and improve the proposals which are on the table.
Well, we will be hearing from the Commission in just a few moments. But first, let me ask Marta, from your perspective, what is it you want from an EU health union? Marta, I think we need to have you unmute your microphone. Thank you.
First of all, good morning to everybody. I am really glad I'm here. I represent OSTIM. My name is Marta Branca, and I'm Vice Secretary General of the European Hospital and Healthcare Employees Association, HOSPEEM. We do represent public and private sector within the health sector, and we are partly independent, partly social actors, and also we are in charge of bargaining. So we want to develop a new European Health Union, and of course we salute this project, especially because we want to achieve the due balance between different competencies of the European Union and the different member states, and of the stakeholders, of course. We think that in order to put into practice the European project on health, in order to protect European citizens and to make sure that all the European patients are taken care of, we think that we need to be in line with the subsidiarity principle, so with the share of different competencies within the health system. So we need to activate a real transparent dialogue between all the different stakeholders and social parts. We are used to use the social dialogue in order to find some solution altogether. So we are ready to share our own experience, our competencies in order to develop the potential of this European project. Thank you.
For your thoughts. Let me turn now to Frank Ulrich. Your perspective is slightly different, but tell me what it is you would like from a EU health union.
consequences of the COVID problem have shown that the finances of health came last and not first, as they should have been. Let's make this a common project of the Commission, of the Parliament, of the stakeholders, but above all, let's make it a project of the patients of Europe. Thank you for listening.
Thank you very much. Now, just a reminder to our speakers, I'm told again by the interpreters that we need to get you to select the correct language on your platform. If you look at your screen, you will see down at the bottom a globe-like icon that says interpretation. Please go to that, and rather than leaving it in original or leaving it switched off, please do select the language that you yourself are speaking in and that you are using. So please select the correct language for the language you're speaking in so that our interpreters have a chance to get the message out to a wider audience. Thank you once again for that. Now, we will turn to our last speaker on the panel. It's John F. Ryan from the European Commission. John, because we have got the EU package presented on the 11th of November, perhaps I shouldn't ask you what you want, but what you foresee for an EU health union.
Thank you very much, and thank you for the invitation to speak to you today. I wanted to make a couple of points. First of all, we are operating in the framework of the treaty, and the public health article of the treaty, Article 168, says that the member states are responsible for the organisation, delivery of healthcare. That is the situation we're in today, and therefore the Commission, taking account of the experience of the pandemic, which is an ongoing pandemic, decided to propose a reinforcement of our legislation, our existing legislation on cross-border health threats, but it's within the context of the current treaty. I wanted to emphasize that point because many of the speakers who've intervened so far are talking about a golden future, a golden horizon, and that's fine, but the Commission is, if you like, restricted by what we can propose in the context of our current legal framework. Now, on the 11th of November, we proposed a package of 3 legal measures, which are linked together and which will, we hope, substantially reinforce the capacity of the member states to prepare for and respond to serious cross-border threats to health. The first element of this package is in relation to preparedness planning. And when we adopted legislation on preparedness planning already back in 2013, the member states immediately started to tell us how difficult this was going to be and to minimize their involvement and reporting on preparedness planning. The Commission is really insisting on this point now, that we should have a much stronger preparedness capacity in the member states by planning not only for known but also unknown diseases, and also to have an auditing, a country auditing and reporting mechanism so that there will be much greater transparency. The member states will not in the future be reporting back to themselves on their own state of preparedness, but they'll have to be the subject of country visits, and also the reports will be shared with the European Council and the Parliament. So there will be a political element here of much greater transparency, and we hope that that will also help to identify where there are gaps and help investment in those gaps. Secondly, there were several references to surveillance, and I think one of the lessons learned is that we only have a partial access to data. Member states themselves have only a partial access to data. They're running around looking for fairly essential data, and therefore we want to reorganize and strengthen the surveillance of communicable diseases, but also the capacity to deal with communicable diseases. In other words, not only counting the number of beds, but also counting the number of doctors and nurses, which we think would be important to deal with an outbreak, and the medical countermeasures like pharmaceutical products and vaccines. The risk assessment which we have at the moment is a very public health risk assessment. In other words, we're just looking at the seriousness of the disease and assessing the impact of that disease in health terms. But we really need to also take account of the pharmaceutical aspects and the aspects relating to, for example, travel. Simple example, when you're doing a risk assessment for an outbreak, you need to take account of the travel in and out of the community and between the member states, which can severely affect, of course, the impact of the disease in Europe. And finally, I would mention the coordination of response, which is a really important aspect. We've got to have a stronger capacity to agree together on what should be the response to a particular outbreak. Now, all of this is in discussion now with the European Council and the Parliament. And just before I give you back the floor, maybe I mention in a wider context on the European Health Union that the Commission is working within the framework of the Sustainable Development Goals. These are goals which are established by the United Nations and which are quite specific. And we also work with the WHO disease-specific targets. So the WHO has agreed with our member states a whole series of targets. This is our general policy framework for disease prevention and control. And we had a mention earlier on of a flagship initiative which we will be publishing in January, which will be a Europe Beating Cancer Plan, which will cover many of these aspects of the determinants of cancer and also the early detection, treatment of cancer and the care for patients. I think the Cancer Action Plan will be a very good test to see how far member states want to go together, how far health professionals want to work together, how far patient groups want to work together on a single topic at European Union level. So I would say this is a very good example of where the European level could add value by selecting a topic and agreeing together to work to achieve certain targets. Thank you.
Thank you, John. Of course, the EU Action Plan was launched here in the Parliament last February, right before everything got derailed by the current pandemic. So we understand we're working with lots of different moving parts. Now, I think one of the elements, or several of the elements that we could break this down into would be patients, hospital workforces or healthcare workforces and the healthcare system, to break it into three parts that we want to talk about on this panel. But before I move on to that, we have actually already got questions coming in. And I think we'd like to come back, Frank. You mentioned in your intervention something about just in case versus just in time. Could you maybe elaborate on that for me, just to clarify for our audience what you mean?
Yes, very briefly, as president of the German Medical Association, for instance, I was involved in the pandemic preparedness plan of my home country, and we thought of everything. We had a fantastic preparedness plan, but we totally forgot that we need material which normally comes within a week from China, and the logistics just wasn't there. So we have to think from just-in-time concepts to what I call just-in-case concepts. We have to have some sort of stockpiling or autarky in our own country by producing at home. Otherwise, we wouldn't have run into the problem with the PPEs as we have done. So this is really important. We must say, and I very much agree with John Ryan, what he just mentioned a few seconds ago. Of course, we have to be clear that the performance of the EU at the beginning of the pandemic wasn't good. But we have to be fair at the same time. Paragraph 168.3 of the Treaty of Lisbon forbids them to deal with the problems of the member states under subsidiarity principles. I think we have to discuss this. We have to give more competencies to the European Union, but we have to get that with less bureaucracy. So I'm trying not to be too optimistic, but maybe that's helpful. If we can manage less subsidiarity, more cooperation and less bureaucracy, then we'll be the real winners.
Okay, thank you. So I think this is all coming down to this word we've heard used already many times in the debate, which is resilience. But I think also there perhaps you're pointing to some of the gaps that have been exposed by the COVID-19 pandemic. Now, Katja, you were saying, I mentioned patients, so we want to take from a patient's. Where have you seen gaps from a perspective of patient care that maybe have been highlighted by COVID, whether that be socioeconomic gaps or other sorts of gaps?
Yeah, thanks for the question. I don't think it will come as a surprise to anyone. It's been covered extensively in the media as well that during the crisis, a lot of standard or regular healthcare services were suspended or delayed, from screening to diagnostics to medical appointments to routine immunization programs. And actually, many healthcare systems are now experiencing a great backlog of treatment and diagnosis, and we still don't know, nobody knows what the toll of that may be in terms of extra illness and deaths. We have done a survey with our membership. Unfortunately, I don't have the results available yet to share with you, but we are looking at the impact of this on patients and also on patient organizations. But we know, for example, that in Finland, in August this year, there were 15,000 more patients waiting for treatment compared to last year. And the Finnish authorities across the country from different regions have estimated that it may take until late 2021 or even 2022 for the situation to become normal again. And this was on top of the delays experienced by patients before. And of course, cancer, which was mentioned by John Ryan, is one of the areas where there have been already studies and some attempted estimates to look at the impact of these delays in cancer treatment, which may well amount to something extremely significant. So this is one of those real gaps that we've seen, even in health systems that would have been described as otherwise very good. On the positive side, we've also seen a very rapid take-up of telemedicines and digital solutions. Because of the urgency, they've been brought up much more quickly than normally would have seen. So basically, this shows that things can be done when there's a will and there's an urgency. So now it's really, I think it's up to the countries as well to assess what has worked well, where the learnings are, and what should be retained from those new practices. And I think it would probably be very helpful if at the European level, all of this knowledge and experience could be brought together and shared, because there are solutions that will bring added value and will actually improve the systems going forward. And if I may just finish on one point from the patient community, unfortunately, we've seen an experience of exclusion and silencing of patient organizations. In a crisis situation, in many countries, patient groups were simply sidelined, even despite statutory commitments to patient involvement. And this has kind of shown that the patient-centeredness in many systems is still not as deeply embedded as it should be.
Thank you. I'm sure our other panelists may well want to pick up on your point about digital solutions and telemedicine. We'll come on to that. But first, Marta, let me turn to you and raise that same issue that Katja's just been speaking about. How do you see the current and future challenges, not only with COVID-19, but, as you said, with the postponement of essential healthcare and elective care that's outside?
Hospitals were under pressure. Several hospitals had to reconvert the beds available, and they had to change them into COVID beds. Also, they needed to find some intensive care, extra places for the COVID-19 patients. That means that we were really focused on this particular illness in order to limit also the contagious. And of course, a part of the patients with other pathologies has been penalized. They haven't been really treated and assisted in the way they deserved, so with the due attention. Lots of these patients were scared enough to go to hospital because they were afraid to take the COVID, and several hospitals were not able to organize different paths for the different patients. So it was impossible for other patients to have access to the hospital. So that means that we can't leave these patients without assistance. So we can't neglect all the other patients with other pathologies, from cancer patients to other patients. We need to be able to develop new tools, and certainly one of these is telemedicine. Telemedicine is clearly the strategy that we might follow, but we have to consider that we need to be able to reach everybody. We can't leave aside a whole set of people or groups that, because of some particular reasons, maybe the social status, or because they are migrants, or because maybe they have some sort of social problems, can't be reached by the telemedicine. So we need to make sure that this challenge is one of the main ones to take up, and the patient needs to be the center of our worries and work. So in order to do that, we need to have the proper the proper courses for all the medical staff. We had some good results with the use of patients in the training for doctors, because the patients in this particular respect can provide a good feedback, and they can have the doctors better understand, and the nurses as well, of course, what do they expect from doctors and nurses. So this is the first system. And then, of course, later on, we need to develop assistance on the territory level. So we need to be really present at capillary level on the territory. We need to have a constant contact with the patients. So even if they have to go to a hospital, they can't take the risk of being infected by COVID.
Well, let me ask you, John, we're hearing there about gaps in where patient care is happening, and different groups. How could a European Health Union actually reduce health inequality and level the playing field across society?
Well, I think if there's one scandal in Europe at the moment which people don't talk about, it's the inequality scandal. The fact that if you're living in one part of a city compared with another part of the same city, you can have years difference in life expectancy. Now, this is not a problem per se, which is the responsibility of the health system, because health is determined by a whole series of different factors. It can be education, poverty, nutrition, living conditions, and so on, also environmental factors. But I think it's one of the big challenges is to try and improve the quality of, general quality of life and life expectancy of our population in Europe, reducing and preventing disease where possible, and ensuring better quality diagnosis and treatment. But doing this in a way where we don't improve the top 5% of the population's health, but we really focus on those populations who are at the bottom of the list, those who are suffering the most from health inequalities. So this is something I'd really be anxious to emphasize in the future, that it should be an approach which really takes into account the inequalities. And if I might lift the cover on the Cancer Action Plan for a moment, although I won't be able to tell you very much about it, I can tell you this much, that one of the ideas which we're planning is an inequalities registry. As far as I know, it's the first registry of its type at European Union level, looking at the topic of inequalities. And the idea is that this would really drive the targeting of our measures. In other words, if we are investing in screening, if we're investing in other measures related to cancer prevention and cancer control, and also which populations would be involved, we really want to be guided by the existing inequalities so that we don't invest in that top 5%, but rather in the bottom 5%. I think that's a really important point, and we hope to systemize this and make it actually part of the system from the beginning. And of course, you could take the same approach for other diseases as well, to try and analyze what are the reasons for the inequalities and how do you reduce them over time. So having targets is a good thing, but the problem with those targets is that vulnerable populations, specific population groups are very often left on the sidelines, and you really need to invest quite heavily to reduce those inequalities. So I think that this should really be the core of our approach to make sure that health of all things should be equally accessible and an equal value for European citizens.
Thanks, John. You've covered a lot of ground there. Now, we've talked about there from the perspective of patients. I want to talk about also the healthcare workforce as a whole, which has experienced immense challenges and quite possibly unsustainable working conditions, as we've seen in different countries across the EU. Jan Willem, how do we deal with this problem, given that we are in the weeds of a pandemic, getting our head above water and working forward?
Yes, thank you, Jennifer. Let me start by linking with a point Kaisha from the European Patients Forum made in terms of the backlog which is building. Not only are health professionals and the whole staff in health and other care units under enormous strain, burnouts, many people under stress, mental problems linked with a point Frank mentioned earlier. They have to make these choices, have to deny some people care because you can't take them in the hospital. You have to refer them to the future. So a point Kaisha mentioned is what many of my colleagues fear is when the pandemic subsides and is over, to catch up with the backlog. So the continuation of the stress there is to just be able to deliver care and rapidly, rightly so, for patients who have had to postpone their treatment to rapidly try to provide the care they need. So many of my colleagues are very worried about this, that the period of stress, also when the pandemic subsides, will continue. And this underlines once again a problem which has been exposed so clearly is the lack of what we call safe staffing levels, having sufficiently well-trained staff available in the healthcare system to be actually able to cope. So one of the things we certainly will want to see in the stress tests is attention to workforce issues and ensure that there are long-term plans there where there are gaps in terms of staffing. This also brings me to another point, is the nature of these stress tests. It's very nice to have indicators and to be able to see that there are problems and then to say there needs to be addressed. But these stress tests need to go further, need to have a more binding character. I've in a past life been involved in the stress tests in the nuclear industry, and these were very binding on member states to actually operate on the results of the stress tests. So I think that we also need in terms of the healthcare stress test. Another point we have experienced and my members are experiencing is the continued battle there is to get recognition for the work they do, and that's not just in terms of working conditions, but also plain and simple in pay. And I already referred to the strange comments we found in the Commission, the economic group in the Commission on workers' pay increases. But in this pandemic has also revealed that many, especially in elderly care, many women on low pay carry a heavy burden in this period. So that is something that needs to be addressed as well. it slightly links with John's point on inequalities, because low pay obviously also means you live in a particular neighborhood where services are less available, living quality is less, etc. So we would certainly also want something like that to be looked into and addressed. If you allow me, Jennifer, and then I'll stop. Just also a word of appreciation for the work of the Commission and John and his crew in particular. In the early days, it was very important that the Commission also provided support to countries in the Western Balkans as well, and to consider that also as part of this process. And certainly, for example, for healthcare workers in Kosovo, that assistance was crucial to keep the system going in those first days. So I think also taking for the European Union, when we look at developing the European Health Union, to also look what happens in the Western Balkan countries and possibly beyond, we think is also important.
Thank you, Jan. Well, you've covered a lot of ground there. But in particular, you mentioned stress tests, which of course is a key part of the S&D position paper. To Frank, to come to this point about the pressure that the workforce has been under, we've had another question in about how do we ensure the supply of future doctors and nurses? How do you do that if many of them are at risk of even burnout? That's a question to Frank.
Sorry, I just had a problem. I don't know, you addressed the question to me. Yes, we do have a problem. We do not train sufficient numbers of physicians in the European Union and nurses as well. And I can just underline everything Jan Willem just said. Working conditions aren't attractive enough. We have young, intelligent people, and when they have the choice, they don't go into caring and nursing. And they are our children. I mean, we train them. They see us working, and they say we don't want to work like our other generations before us. So we have to invest in training and education. We cannot rely on a brain shift from other countries from outside. And I think COVID has shown us very, very much how thin the layer is of surplus work, and that a pandemic very, very quickly and briefly brings us to our limits. So we do need more physicians in Europe. We do need more nurses, midwives, and other health care professionals, because otherwise, and that means we need more money. And I can only re-emphasize the discussion on the multi-annual framework and on the extra finances for the COVID crisis was a bit of a shame, because there were 9.5 billion euros in the offing at the first, and it ended up at 5.7. So I think we would have needed the full money for healthcare services.
Thank you. Marta, did you want to weigh in on that question as well, please?
Let me say that I fully share the words I just heard, because training for us as well is a paramount aspect. We have had a dialogue with other bodies in recent years about the long life training and about the possibility to continuously follow the training in the medical sector. This is very important for the safety of workers as well. So they need to be particularly competent, and have a specific training. And this is also true for those who not necessarily work in intensive care, but that in particular situations like the COVID-19 one have to do that. So when it comes down to the employers in this particular phase, we are fully aware of the needs that arose. For us, it is important as well to have the possibility to have more financial resources when it comes down to the health system, health sector, this is an important investment for the safety of workers who are the main resources in the hospital sector, and also for the safety of patients.
Thank you, Marta. Well, we're almost out of time, but let me finally touch on the last area which we haven't really discussed, which is pharmaceuticals, and in particular the COVID-19 vaccine that we all hope and need to come as soon as possible. So John, this is also a question that has come in from our audience. Obviously, this issue has been raised. John, let me ask you briefly about the vaccine. How do we get it out to people in a fair and equitable manner? And let me add on to that my own thought on to the question from our audience, a sustainable manner. Does it need to be produced in Europe? Is that something we need to think about for our pharmaceutical future?
Right, so a couple of points here. First of all, on the workforce point, if I might go backwards, and sorry to take your time, I think workforce is really the key to a lot of the European Health Union issues in the future. If we don't start by workforce issues, we will never solve our problems. We have an aging population in Europe. We will have increased demand for healthcare services. We have what has been called a tsunami of chronic diseases. We've been talking about communicable diseases so far, but the real tsunami is non-communicable diseases. And therefore, the burdens on our healthcare system are going to increase dramatically and not decrease dramatically. Whatever we do about prevention of non-communicable diseases, we will never turn off the taps on this huge number of cases which are coming our way. And at the same time, our healthcare workforce is also aging at the same time. People are leaving the profession. Countries are offering higher wages in order to entice healthcare workers from one part of the European Union to another. This is absolutely not sustainable. So I think the whole issue around workforce training, integrated care between the social and medical services needs to be looked at very seriously. Whether or not we have a change of treaty, we still have to do something about it so that member states don't have to face this on their own. The rural populations, the medical deserts we're seeing popping up across Europe, this is really something which is not for tomorrow, it's for today. On the issue of vaccines, the Commission and the member states together decided to arrange for advance purchase agreements with vaccine manufacturers. There's not one vaccine, there are 6 which we're looking at the moment, and there may be even more in the future. And the first precondition was that the manufacturing of these vaccines should be based in Europe. Why did we insist on that? Because we've seen with certain medical products like remdesivir, for example, that the United States blocked the majority of the production for these products, even if the production sites were based in Europe. Through the United States legislation, they were able to impose their conditions on United States companies operating in Europe. So we've got to really make sure that we have a guarantee of supply of pharmaceutical products in Europe. And this was really, I would say, a first concrete effort in that direction to negotiate together between the member states and the Commission to ensure a supply. And secondly, the member states agreed not to.
Los Estados miembros se pusieron de acuerdo para.
The member states agreed not to negotiate separately.
No negociar de manera separada.
I think the Spanish interpreter is coming in on my line.
I think, John, I think we'd reached kind of the end of your points anyway, and I was going to hand over briefly. Kasia, can you reflect on the access to medicines, in particular vaccine and pharmaceuticals, from a patient point of view? As I know we are running short of time, but if you could briefly.
I know we are running short of time, and in fact, yeah, I think that in this area, the European collaboration can really bring added value. And what's going to be important, because I have about 3 seconds, is that the vaccine is made available to people based on needs in an affordable and accessible way. And it would be great if there could be a coordinated strategy for this. Obviously, people with chronic conditions are amongst the vulnerable groups for COVID-19. So it would be important from our perspective that they were included amongst the priority groups.
Thank you very much, Kasia. I think we will leave it there for everyone. I think we've really had a good discussion. There's far too much to get into in this quite short time. We didn't manage, on my notes, we didn't manage to get to telemedicine or these digital solutions that I wanted to talk about. We perhaps didn't talk more about funding, but perhaps that's all for another day. And of course, you can continue this discussion using that hashtag EU Health Union. With that, I think I will hand over just to wrap up and give us your final thoughts on everything that you've heard today from all the different perspectives. Once again, the S&D Group Chair, Iratxe Garcia Perez.
Thank you, Jennifer, and thank you all participants in this wonderful webinar. We had the opportunity to know much better the different perspective from the patient, from the professional, from the institution at a different level, European, national, and I think that it was a great opportunity to advance and to work in this principal goal that is the health union. Creo que evidentemente hemos podido escuchar diferentes perspectivas y hay algunas conclusiones en las que estoy segura que compartiremos algunas de las ideas. En primer lugar, el reconocimiento que tenemos que hacer al trabajo como decía uno de los compañeros que han participado en el evento, de los más de 2 millones de trabajadores y trabajadoras del sector de la sanidad que han estado bajo una presión muy importante y que han dado lo mejor de sí mismos, ¿no? Yo creo que nunca tendremos el suficiente tiempo de dar esa palabra de agradecimiento al sector sanitario, desde los doctores, enfermeros, personal de asistencia, celadores, limpiadores, creo que han demostrado que son una parte fundamental de nuestra sociedad y ese aplauso que era compartido en toda la Unión Europea en el inicio de esta pandemia, en el mes de marzo, tiene que convertirse en un reconocimiento a través de nuestro trabajo y de nuestro esfuerzo desde las distintas instituciones. El plan de recuperación que se plantea en estos momentos por parte de la Unión Europea es una buena oportunidad y es una buena oportunidad para plantear los objetivos prioritarios sobre los cuales debe de basarse ese plan de recuperación y uno de ellos debe de ser evidentemente el fortalecimiento de nuestros sistemas públicos, del sistema público de sanidad. La respuesta a esta crisis tiene que ser totalmente distinta a la respuesta de la crisis del 2008. La austeridad no puede ser la solución, sino todo lo contrario, el apoyo a los sistemas públicos de sanidad, porque evidentemente hemos visto que esa austeridad ha provocado el debilitamiento de sistemas públicos sanitarios en muchos países que se han visto en verdaderas dificultades para poder ponerse al frente de esta crisis. Por lo tanto, en primer lugar, el principio fundamental del apoyo a los sistemas públicos de sanidad, el avanzar en una unión sanitaria donde la coordinación sea un elemento fundamental, donde también tengamos en cuenta la perspectiva de los pacientes. Y aquí se ha hablado de una cuestión que es fundamental y es la dimensión social, que no podemos perder de perspectiva. Hablamos de pacientes en nivel general, pero no podemos dejar de ser sensibles y conscientes de que hay sectores más vulnerables de la sociedad que, por lo tanto, necesitan un mayor apoyo a través de las políticas públicas y que la desigualdad no solo se da en términos de territorio, sino que se da también en términos de perspectiva social. Y en ese sentido, incluir la dimensión social en la política europea hacia la unión sanitaria es fundamental. Hemos hablado del plan de vacunas y de cómo tenemos que coordinar y cooperar y también hemos escuchado hablar de la dimensión internacional porque evidentemente hablamos de una crisis global que está afectando a toda la Unión Europea, pero no solo a la Unión Europea. Y también debemos, por lo tanto, de tener en cuenta la perspectiva de la cooperación internacional para poder dar garantías de que esta pandemia no solo se consigue mitigar dentro de la Unión Europea, sino también fuera de la Unión Europea. Se ha hablado de los Balcanes, pero no podemos olvidar un continente vecino como es África, que también necesitarán del apoyo y de la cooperación desde la Unión Europea para poder acabar con esta pandemia. Nos han quedado muchísimas cuestiones por debatir, hablar de la política farmacéutica, hablar de cómo podemos avanzar en estos términos de coordinación y de cooperación. Esta ha sido una primera iniciativa desde el Grupo de Socialistas y Demócratas. Queremos volcar todo nuestro esfuerzo y nuestro trabajo en conseguir que esta crisis se convierta en una oportunidad sobre todo para no dejar a nadie atrás. Por lo tanto, mi compromiso como presidenta del Grupo de Socialistas y Demócratas de continuar trabajando en este...
is to carry on our work forwards. This was our first initiative, but of course we will have many others. We will continue to work with all of the different stakeholders, organizations, and all of the professionals of the field, because this is a task that is shared, just as the responsibility is shared. The S&D group is available for all of you to not leave anyone behind and use this crisis as a true opportunity. Thank you very much to all of you, all of those that were present today, to all of those that were connected on the webinar online, and we will be available to all of you.
That a healthy EU is possible.
Thanks, Jennifer. Bye-bye.
Thank you. Bye.